There are many different types of treatment for prostate cancer. One of the most effective is the CyberKnife, as we learned from Dr. Asif Harsolia of Orange County CyberKnife.
Prostate cancer is one of the most common types of cancer that develops in men. It occurs in a gland that's located, between the rectum and the bladder, about the size of a walnut, and it aids in men's reproductive function. Essentially, what happens in prostate cancer is the glands that make up the prostate transform. They begin to replicate in an abnormal fashion, and that's what we call prostate cancer. So it's when regular cells of the body actually start replicating in an abnormal fashion.
We ask how prostate cancer is diagnosed.
Typically, most men in the United States are diagnosed by a blood test called the PSA. It's either through that or through a digital rectal exam that a physician performs that most men's prostate cancer is found. In rare instances, more advanced cancers are found by other means, such as blood in the urine or pain, and those types of symptoms.
The doctor told us about the range of treatments.
There are multiple different ways to treat prostate cancer, and the most important thing is, I think, and this is what I tell, all of my patients, is that prostate cancer is actually a spectrum of disease, ranging from low risk to very high risk. And no prostate cancer or individual is the same. So it's very important to tailor the aggressiveness of the treatment to the aggressiveness of the disease. And because of that, it can range from as passive treatment as observation or watchful waiting, to as aggressive as doing things such as surgically removing the prostate gland, using CyberKnife or radiosurgery, conventional radiation treatments, or brachytherapy, as well as hormonal therapy and sometimes even chemotherapy.
Just what is CyberKnife, and how is it used for prostate cancer?
So CyberKnife is a relatively newer modality in the treatment of prostate cancer, and it has come about in the last few years. And the premise behind it is that historically, we have one of the main treatment modalities for prostate cancer has been the use of something called brachytherapy, which uses high doses of radiation that are implanted directly into the prostate gland using a surgical procedure. And the idea of CyberKnife or radiosurgery is to replicate the dose that we deliver through brachytherapy, but doing it through non-invasive means. And what it does is it uses very high doses of radiation that's pinpointed with sub-millimeter accuracy to a target, in this case the prostate. And the advantage of doing that is because the prostate is located in between the rectum and the bladder, you have to deliver high doses of radiation treatment to the prostate while not damaging the rectum and the bladder. And that is one of the big advantages of the CyberKnife. We not only do this in a 3D fashion, but we also look at the motion of the prostate gland in real time. And that's one of the big advantages of the CyberKnife, is that it can actually track motion of a tumor or the prostate gland in real time as it's delivering the treatment. So you are more precisely targeting the gland on any given day. To date, the CyberKnife treatment has been shown to be quite safe in a variety of areas of the body. And in particular in prostate cancer, to date, the rectal and bladder complications